this episode, we will discuss the similarities and differences between each of these countries, as well as bring up information that we noticed matches well with the information mentioned in the last 2 episodes, which you can access in the card up top on the right-hand corner. Yasmin, would you like to start off our conversation? Oh wait, I paused instead of hold on. Sorry. Okay. Sorry, we're going to record that again. Okay. Yasmin, would you like to start off our conversation?
Sure, I would love to. So, Pamela, I remember you mentioning how women are feeling more depression and anxiety and a stress overload due to the outbreak of the pandemic. Do you mind maybe elaborating more on that?
Of course. Okay. We need to know that with all of this pandemic, well, thank you for the COVID-19, the society have a really big change. Not only in the economy, but otherwise in in our social media and in our families. Okay, well, because of the confinement, sometimes the aggressor, well, in this case, someone in their home or in your work, can control the victim, in this case, the woman's. And well, we are more likely to be exposed to, for example, to the world and all the social media, the activities, and all of that. I saw that Jasmine, you write in your article, in the article that you write, that in Egypt and here in Colombia too, we have the same month for the lockdown. We get in lockdown in March of 2020, 1 year before right now. And well, all of this increase a lot of the oppression, has increased the suicides and the anxiety and the feeling of guilty, because we know that, well, the women have a very important paper in the house. Maybe it's because you get ready of your kids or your brothers or maybe your family, you make the breakfast and all of that. And since that happens and the men or the aggressor in this case do not have like the possibilities to do something else or get out of the house or the place of where you are or where we are, they like discharge all these energies in the women's, because always they are going to see like the women's like inferiors, because well, in the society they show the women's as inferior as the men's. I don't believe in that. I think we are powerful. We have a little bit no, a lot of shine inside of us. So I think the pandemic can change our life. Well, did it change our life? And we are going to pass not only through this, but I know we can handle more than that. And all the women are strong. We have a lot of support, and now in the present, well, we have more more support. We have organizations that have our back and all of that. So
yeah, I completely agree with you, Pamela. I mean, even in Egypt, the culture is very similar to that of Colombia. So we have also seen a increase in the number of women who are staying at home, which confines them to the more time with their abuser, and they may receive domestic violence. which is brought about by the pandemic. And not only that, but now that people are losing their jobs, especially women, they are now handling the stress of working and trying to find jobs from home, but also maintaining, household duties and taking care of the children and taking care of elders, because many families tend to live together in these cultures. So it has put a very immense amount of stress on the mental health of women in Egypt and as well as Colombia that we've seen. So anxiety rates have also increased along with suicidal rates as well. So in the study that I was researching about, the article was mentioning how self-determination and like the feeling of empowerment is such has like such a significant effect on, like the success of women. And so many women who were feeling a lack of this, if they had been feeling more self-determination, they would have more freedom to engage and develop new ideas and be able to work more efficiently and effectively in the organizational workforce. But being with the outbreak of COVID-19, there has just been this like extra added stress on them. So it's actually having a negative effect on the economy, and especially because women also do participate in the workforce. So I thought that was a very interesting similarity to see within the cultures. So Faith, I also remember you saying something about Decree 460 in Colombia, which was passed last year in response to the rise in domestic violence cases. So in Egypt, we also want to help women with mental health specifically, and companies have taken certain actions to improve the mental health and well-being of women by they have been mandating more work from home policies. They have also encouraged leaders in organizations to take stand and to encourage women, and also kind of give them the leniency to be able to express themselves. And so I was wondering what your thoughts were on that.
There's definitely a similarity in how it's not necessarily just women-based organizations who are making an effort to improve the lives of women as well. I think there's common recognition of the importance of protecting and improving their health and well-being felt by both Colombia's national government as well as the different companies and businesses within Egypt. One main difference would be the scale. So in Colombia, it's like a decree. It's a national law, while in Egypt, it's smaller scale since it deals with more local entities or more local institutions. And I think there's different levels of implementation. I think focusing on businesses might be more effective in implementing change because it's harder to execute a law and make sure that it's enforced in all aspects, as I have mentioned previously, because even though the national government did pass Decree 460 in March of last year, it's not necessarily followed by all places within Colombia. And it also doesn't recognize all of the problems. However, based on what I heard from your explanation of the companies and businesses, there seems to be more being done and managed to be executed for the various workers.
Yeah, I mean, completely. I definitely agree with you in how it would be easier to implement, change and beginning with a company or the local workforce, just because, you know, there comes like a lot that goes into passing laws as far as government change goes. So definitely starting from like company wise, it's a step forward. I mean, it's not perfect, but it is definitely something that would, you know, improve the lives of women post COVID-19 and hopefully in the future.
Yeah, I also noticed that it's slightly different in the sense that there's a concern for the mental health and well-being um, of women and all of the workers, not necessarily caused by domestic violence or violence from an abuser themselves, but mainly like the amplified demands that that rose up because of the pandemic, since women are expected to do a lot as well. And I think that's also experienced everywhere, really, since a lot of countries have experienced more expectation and more demand for women to take on a lot of different roles as well. So I think Decree 460 doesn't necessarily recognize like scope of women's issues or of how much stress other things rather than just domestic violence can affect women, which is also an underlying limitation of this law. Um, are there any underlying limitations in some of the mandates or some of the policies that businesses and companies that you've looked at regarding what they might be overlooking as important to address?
Yeah, so I definitely saw that, according at least to the study that I read, um, most of the research that was conducted, the sample had been from a range of 35 to 45-year-olds, and 61% of those people had attained a high educational degree, so like a master's or a doctoral degree, and 58% were positioned as middle level management. So I think something that's being overlooked is, you know, the lower class, as is in any country. It seems to be an issue that the whole world faces. The lower class is often neglected when it comes to these reforms, especially those who are working labor and such that is just lower pay, and it's just even sometimes unpaid, as I mentioned earlier. So I think that's something that definitely needs to have emphasis put on, either by government action or by just local authorities.
Hi, Catherine. I remember you mentioning survey results regarding how 11% of women who took the survey experienced violence from their significant other, and 4% of the 11% have previously experienced that violence, while the rest, women who experienced the domestic abuse, was actually due to the virus. Like they experienced the violence after the pandemic. So I do have two questions regarding this. Do you think that reporting these cases may be an issue as well? Like women don't feel as though what they are experiencing needs to be reported? Or maybe it's a case of sample size.
Well, I believe that many of these women were scared to report that they were being abused. And also, majority of the women that were surveyed actually lived in rural areas. So since they lived in these areas, they may not have direct access to go and report this, or they may be, like I said, they may be fearful of getting the coronavirus. And then also in another article that I mentioned, we can see that women are afraid to seek healthcare and in general just help from others during political and health crises. So this could be a good reason for why these women may not be reporting their domestic abuse that occurs in the household. And also in the article that I read, you can be seen that there was a majority of these women were experiencing verbal abuse. And then after verbal abuse, they would be being hit. And then after hit, the woman would be being pushed.
Why do you think domestic violence has risen because of the virus? This is mainly due to the fact that out of the 11% of the women who said that they experienced violence from their significant other, 7% of the 11% said that it resulted from the virus.
I believe that the 7% that had experienced the violence, that had not experienced it previously, it had came from living amongst the virus, because the husband may have been laid off from work, and because he was laid off, he may be taking his anger out on the wife. Or it could be just because they're both not leaving the house. There's nowhere to go because many things were shut down. The economy was suffering. So that since they're both in the house, they don't have an escape like they usually do to go get help, or they may not be able to see family and friends to escape this violence because, like I said, the fear of contracting the virus. Faith, I also remember you mentioning how Decree 460 is a step in the right direction for violence against women within their families, although it does not address all forms of violence against women. Can you elaborate on the other forms of violence that occur against women?
So in the month of March 2020, there were 5,138 cases within the family that were reported, with 3,376 cases between spouses. So where the significant other was the abuser. However, also in this month, there were 1,149 cases of violence that were between other families. So it isn't necessarily just occurring within one family. And I think that's why it's slightly a limitation. And I can understand why the decree focuses more on domestic violence itself, since there's like a really high number that is related for within the family as well. But I think in order to try to mitigate the danger that women feel towards towards being outside of the house or inside of the house, hopefully there are other steps being taken and more improvements that are being made or have already been made to address the violence that could also happen just in public spaces. Like I mentioned earlier, people may be going out and about to work or to get groceries, but because of the limited activity outside of the house, more people are able to get away with committing acts of violence against women, simply because there's less people to report and there's less witnesses, which increases the level of danger and the vulnerability that women may feel. So, Camila and Pamela, can you talk about your perspective of violence against women in Colombia, since you live and study there?
Yeah, okay. First of all, it's important to keep in mind that Colombia could be, in some part of the country, a very conservative country with these gender roles really structured. Um, the gender roles that the women is always at home with children, with the kitchen, and the man is the one who's working, like the head of the house. And I think that it could lead to gender violence. And yeah, also, Colombia has uh, strong values of religious values, and the 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 image of the women as a power as a powerful person is not that common in conservative families here in Colombia. But um, it could change from one house to another, because of course we are not the same. Pamela, do you want to add something else?
Yes, of course. Okay, well, as Camila said, here in Colombia, we will have cases about violence in their family and in the social, and well, every time it's different. We can present well, violence against women and to the richest family, to the poorest family. Um, it's different because always they are going to ask like, you have any stereotype of any aggressor in Colombia, for example, or around the world. It's going to be difficult because always the reasons are going to change. Maybe it's because the aggressor is angry, or maybe the person that is affected, in this case, the women's, they don't listen to the orders that the aggressor said. So I think it depends. Nothing is going to be perfect, and well, we have violence here, but that's not mean that we cannot get out from this, and this is something that passed. And well, we are going to support the women that have like these difficulties, and the best that we can do is give it a shot to try different things.
Yasmin, although you grew up in the United States, I know that you also have relatives from Egypt as well. And are there any stereotypes that maybe the United States holds towards Egyptians as well when it comes to issues such as mental health or domestic violence?
Yeah, I would say so. I can't speak so much on domestic violence. I'm not too equipped on that knowledge, but stereotypes in general, I guess, towards women, that the US kind of sees is that women are more so, I guess really with just the Middle East in general, is that women are mainly not oppressed in the sense, but in a way that they're seen as more like they don't belong in like the workforce, or that Egypt or other Middle Eastern countries are not progressed in the sense of women being involved in the community outside of the home. So I think at least people in the US who are not as educated as others, they kind of have that idea of women in general, of the Middle East. So I think that is an important factor to kind of take into consideration when talking about, I guess, stereotypes.
So, Kendall, I remember you saying that Al-Shabaab provided women with multiple services to better their health and well-being. Similarly, UN Women has called upon Latin American governments and the international community in general, the private sector, and the other actors to prioritize prevention, care, and punishment of violence against women and girls through four main strategies. The first one is access to care that ensure access to essential care services. For example, facilitates access to the justice system, hospitals and healthcare services, legal advisory, and psychological support. The second one is partnership with organizations, work closely with civil society organizations and networks of women human rights defenders. These organizations are the experts on women needs, and it is important to strengthen their capacities and resources to respond to the crisis. The third one is zero tolerance. Have zero tolerance for gender-based violence, ensuring that police and judicial services prioritize attention and punishments of violence in parallel involve the community to unite against gender violence. And the last one is invest in prevention. Increase investment in prevention through educational programs, public campaigns, and programs geared towards the empowerment of women and girls, seeking to transform harmful masculinities or social norms that encourage or tolerate violence against them. So UN Women welcomes the fact that many states have responded to violence against women and girls by adopting measures such as declaring an essential service to care for victims, establishing partnerships with hotels to provide free shelter for women victims and survivors, and automatically postponing the expiration of precautionary measures protecting victims of violence within quarantine measures.
Although our two programs have many similarities, there are some differences, such as where your program invests in prevention and works to educate the public and transform harmful masculinities. My program is based more about like working with victims of domestic violence and helping them get through what they've suffered. But they both do have access to essential care services, such as working with the justice system and healthcare services. And they also both incorporate psychosocial support. And they do also both have partnerships with different organizations that work to benefit women. But my organization doesn't mention anything about the zero tolerance policy. But overall, I think that they're both really beneficial to women and help them get through tough times.
So all in all, we can kind of see a lot of similarities and differences between the cultures in Colombia and Egypt. And we can see that, especially with the outbreak of COVID-19, there have been many struggles that women in both countries are facing that are very similar and can be changed with government action or local action, which is something that should be emphasized on in the future. We just wanted to thank you for listening to our analysis of both countries and hope that maybe you took something away from it.